Sympathetic stimulation on heart increases heart rate with tachycardia, increases AV conduction, and stimulation of ventricle. Sympathetic on eye it produces dilatation of pupil due to stimulation of dilator pupillary muscle or radial muscle iris, which is called mydriasis. Bronchi, bronchodilation. GIT and urinary. GIT relax wall and contracts sphincter, so decreases gut motility. The same with urinary, relax wall and contract sphincter, inducing urine retention. Blood vessels reduces vasoconstriction and vasodilation. Salivation, increased vessel secretion, sweating is increased, and sex organs responsible for ejaculation. Beta-1 receptors increasing all cardiac factors. Eye contains alpha, responsible for mydriasis. Bronchi, bronchodilation, beta-2. GIT, alpha contracts sphincter, beta relax wall. Urinary, alpha contracts sphincter, beta relax wall. Uterus, alpha produces uterine contraction, beta-2 produces uterine relaxation. Blood vessels, alpha vasoconstriction, especially skin and mucous membrane vessels, and beta-2 vasodilation, mainly skeletal muscle vessels. Other actions: insulin release. Alpha-2 inhibits insulin release. Beta-2 stimulate insulin release. Lipolysis. Alpha-2 inhibits lipolysis. Beta-1 stimulate lipolysis. Renal release. Alpha-2 inhibit renal release. Beta-1 stimulate insulin release. Alpha increases neuromuscular transmission, and the beta reduces glycogenolysis. Beta also are responsible for increased uptake of potassium inside cells, inducing hypokalemia, also responsible for tremors, and they have a role in aqueous humor formation. Noradrenaline, after producing its effect, rate is mainly reuptake, 80% reuptake, about 15% are metabolized by enzymes, MAO and COMT, and about 5% excreted in urine unchanged. Sympathomimetics are drugs which produce action similar to sympathetic stimulation, or drugs which stimulate adrenergic receptors. They are classified into catecholamines and non-catecholamines. Catecholamines, we have natural catecholamines, dopamine, noradrenaline, and adrenaline, and synthetic catecholamines, isoprenaline and dopamine. Non-catecholamines, for example, ephedrine and amphetamine. Mechanism of action. Direct acting on adrenergic receptors, either alpha or beta or both, for example, catecholamines. Or indirect acting by releasing noradrenaline as amphetamine. And you have dual mechanism or mixed acting as ephedrine. Sympathomimetics act indirectly act by releasing noradrenaline from nerve ending. If they are given repeatedly in a short period of time, their effect on blood pressure is gradually decreased. It is decreased rapidly. This is called the acute acquired tolerance, which is called tachyphylaxis. It occurs with indirect acting sympathomimetics. Adrenaline or epinephrine. It is a natural sympathomimetic category. It is sensitized in adrenal medulla and some areas in CNS. It is unstable in presence of light. It is oxidized into adrenochrome, which is pink in color. So adrenaline should be put in dark glass, dark ampoules, to protect it from light. And it is unstable in aqueous or alkaline E, so it should be kept with preservative. In blood, it is stable due to presence of reducing agent as ascorbic acid and glutathione. It is not effective orally due to vasoconstriction, gut mucosal vessels, and destruction by gut and liver enzymes. So it is usually given subcutaneously. Dynamics. It is a direct agonist on alpha and beta receptors. Local actions. By acting on alpha 1 receptors, it produces vasoconstriction of blood vessels, so it is decongestant and dehemostatic. It can stop nasal bleeding. It delays absorption of drugs when combined with local anesthetic to prolong their applied locally on eye, it produces decongestion and decreases intraocular pressure, but it has little effect on pupil size when applied locally due to vasoconstriction and destruction by alkaline tears. If it is given by inhalation, it produces bronchodilation, beta 2, and decongestion by alpha effect. Systemic action. Cardiovascular. Heart contains beta 1 receptors. Adrenaline has positive inotropic effect, will increase contractility. Positive chronotropic effect, increasing heart rate. This will increase cardiac output, increases myocardial work, and increases myocardial oxygen consumption. Increases conduction, which is called positive thromotropic, increases excitability and automaticity. Blood vessels. Vasoconstriction, mainly skin and mucous membrane vessels through an alpha 1 effect, and vasodilatation of skeletal muscle vessels by acting on beta 2 receptors. Constriction increases peripheral resistance and dilatation decreases peripheral resistance. So the net effect on total peripheral resistance, it is little affected. It may be slightly decreased or not changed, but with increased dose, peripheral resistance is increased. Blood pressure. We have systolic and diastolic pressure. Systolic pressure depends on cardiac output and total peripheral resistance, and diastolic depends on total peripheral resistance. Adrenaline increases cardiac output, and the peripheral resistance in therapeutic doses is slightly decreased. So the effect on blood pressure, adrenaline will increase systolic pressure due to increased cardiac output, and diastolic is slightly decreased or not changed or increased according to dose given. So mean blood pressure is increased. Adrenaline produces hypertension by acting on alpha and beta receptors. If we block alpha receptors and then give adrenaline again, it will act on beta 2 receptors, inducing vasodilatation leading to hypotension. So action of adrenaline on blood pressure is reversed by alpha blocker. If we add beta blocker and then give adrenaline again, of course, no effect, because now we are blocking both alpha and the beta receptors. Respiratory system, bronchodilation, beta 2, decongestion, alpha. On GIT, relax wall, beta, and contraction sphincter, alpha. The same with urinary. Relax wall, beta, contract sphincter, alpha, inducing retention. Uterus, the effect is variable. In non-pregnant uterus, adrenaline reduces contraction, but in human pregnant uterus, it reduces relaxation by acting on beta 2 receptors. Metabolic actions. Hyperglycemia due to increased liver gluconeogenesis and inhibition of insulin release. Increased blood lactate level by increasing glycogenolysis and skeletal muscles. Increased fatty acids and increased lipolysis. Calorogenic action and increases oxygen consumption and increases basal metabolic rate. It increases blood coagulation by activating factor V. Hypokalemia due to increased uptake of potassium by cells through beta 2 effect. Skeletal muscles, facilitation of neuromuscular transmission and anti-fatigue. Adrenaline has anti-allergic action. Histamine reduces hypotension and bronchospasm by stimulating histamine receptors. Adrenaline reduces bronchodilation and hypertension by acting on alpha and beta receptors. So adrenaline can antagonize the action of histamine on bronchi and blood pressure, but by acting on different receptors. They do not act on the same receptor. This type of antagonism is called physiological antagonism. Therapeutic uses. Treatment of allergy as angioedema and anaphylactic shock. Usually added to local anesthetics to delay absorption, prolong their duration, decrease toxicity to local anesthetic, and minimize bleeding. Acute bronchial asthma could be given inhalation or subcutaneous, but drugs which are selective on beta 2 receptors are much better. Could be used in treatment of hypoglycemia induced by insulin, but glucose is much better. Could be used as hemostatic to stop nasal bleeding locally in episodes. It is given intracardiac in cardiac arrest, and it could be used in treatment of glaucoma, but it is not a common drug in treatment of glaucoma. Routes of administration. Usually it is given subcutaneously. It reduces vasoconstriction, and this will prolong its duration. Inhalation in bronchial asthma, eye drops in glaucoma, intracardiac in cardiac resuscitation. Adverse effects. It may produce gangrene if injected with local anesthetics in fingers or toes. May produce hypertension and cerebral hemorrhage, tachycardia, palpitation, arrhythmia, angina, skeletal muscle tremor, anxiety, and headache. Contraindications. It is not used with local anesthetics in fingers or toes. contraindicated in hypertension, in angina pectoris with myocardial infarction, in cardiac arrhythmia, and in hyperthyroid or thyrotoxic patients. In thyrotoxic patients, increased thyroxine will increase number and sensitivity of beta receptors. Should never be used in patients receiving digitals. It will produce fatal arrhythmia. If used with some general anesthetics as halothane, also it can induce arrhythmia. With MAO inhibitors, it is not metabolized. This will increase its action. And in patients receiving non-selective beta blockers, it will produce severe hypertension.